Hey guys. Hope that you guys are doing great. Happy Thursday. So I want to talk about this topic, top fibroid triggers, okay, and what to avoid. Because, I know I get a lot of inboxes, I get a lot of messages, emails, mostly from women that have fibroids, and they want to know what they should do and all that stuff. So this live is going to talk about if you're in, please put a 1 in the chat. By the way, put a 1 if you can hear me, if you can see me perfectly. Okay, because I know Facebook can be crazy sometimes. But if you can see me, you can hear me, put a 1 in the chat. So I want to talk about top fibroid triggers, because when it comes to fibroids, I mean, they're just so common nowadays, and a lot of women don't realize. Thank you, Dr. Selena. A lot of women don't realize why they develop fibroids, or that they're still engaging in habits that's going to, like I said, continue the development of fibroids. That's going to make their fibroids grow. Okay, and unfortunately, a lot of fibroids are just so common nowadays. So it's good for women to know what exactly what they can take out of their diet, their lifestyle, that's going to help them in the process of shrinking their fibroids naturally. For the ones that want to shrink their fibroids naturally, because I know not everybody is wants to do that, but most people that follow me want to get rid of their fibroids naturally. Okay, so I'm going to tell you some of the top fibroid triggers. Of course, I cannot tell you all of them because we will be here all day. I'm going to tell you some of the top ones, okay? And if y'all have any questions, let me know, okay? So I get a lot of messages from women with fibroids, but I also get messages from women that have same, polyps as well. Things like, cysts, endometriosis, PCOS. These are there's an array of uterine issues that can occur in the uterus. There's an array of different issues that can occur in the uterus, and people like to separate these things, but I always tell you guys to look at the root causes of them, because the same root cause may show up as fibroids in one woman, and then in the next woman it may show up as cysts. So, but it's the same root cause, right? So don't look at these health issues as so separate. These uterine health issues, because they all occur for the same reason. Okay, but anyway, okay. So the most common uterine issue, unfortunately, is fibroids. Hey, Roxana. Unfortunately, in the U.S., studies show that about 70% of women, okay, up to 70% of women will get fibroids before the age of 50. And if you are watching this and you're a Black woman, that number is about 80 to 90%, okay? It is ridiculous how the amount of Black women that are suffering from fibroids, and there's a lot of women that have fibroids and have no clue, right? It's crazy. And as far as Black women, we tend to get them at earlier ages, okay? We tend to get them, they grow, they tend to grow bigger when it comes to Black women. They tend to be more aggressive. The symptoms tend to be a lot more aggressive. So they tend to really interfere with our quality of life much more than any other race of women. Not saying that any other race of women doesn't suffer from fibroids as well, because trust me, they do, okay? When it comes to Black women, we're also 2.4 times more likely to get a hysterectomy, okay? And I always tell you guys, hysterectomy is something you want to avoid, okay? And we're 6 to 8 times more likely to get a myomectomy, which is the removal of fibroids, okay? So I want to talk about what are some things that we can stop doing, that we can stop eating, that we can stop consuming, that's going to, that is not going to help you continuously feed these fibroids. That's what we don't want to do, okay? If you guys don't mind, go ahead and share this live stream, okay? Share this, because we need more women to hear this. If you see 10, if you know 10 women, right, at least 7 to 8 of them are dealing with fibroids. That's a crazy number. Fibroids is an epidemic, okay? And a lot of women don't understand, that there are different ways to shrink their fibroids, get rid of them. They only know what the doctor's telling them, which is surgery, okay, or birth control, which is not the best treatment for fibroids, because we know that they grow back, right? If we don't change our lifestyle, we don't change our diet, all right? So share this live if you can, all right? So for those that are new to me, for those that are following me and watching me live for the first time, my name is Sasha, okay? I'm a holistic women wellness specialist, okay? What I do is I help women who are struggling with womb health issues, reproductive health issues, or infertility. I help them engage in everyday health habits in order for them to heal naturally. I help women utilize holistic methods of healing, okay? Which is very important when we're talking about healing the body, when we talk about healing the womb, because if you have fibroids, then it's not just an issue in your uterus. It's a full body issue, okay? That means there's an issue with your organs, with your hormones as well, with your organs, okay? So I teach women how to get to the root cause of the problem in order to heal these issues, in order to heal fibroids, in order to overcome infertility, and all other reproductive health issues as well, okay? So let's talk about fibroids, ladies. Let's talk about fibroids. So what are fibroids? What exactly are they? So they're pretty much an accumulation of waste. I mean, that's pretty much what they are, and bad cells in or around your uterus, okay? They form due to a malfunction in your body's detoxification process. So whenever there's a malfunction in your body's detoxification process, that means that waste is going to collect in your body, and they form into fibroids. They form into those which is, can be, they form into tumors in your body. Okay, whether they're inside your uterus or outside your uterus, because fibroids can also be outside of the uterus, in case you guys didn't know, okay? So of course, we want to shrink and get rid of these things. We do not want to continuously keep these tumors in our bodies for years and years and years, okay? That's why I don't understand why women, tell me they're too busy to not address their fibroids, not do anything about their fibroids, not change their lifestyle in order to shrink their fibroids. I hear that a lot, and I'm just like, you don't understand that fibroids grow. When you continue to engage in habits that, that cause them to develop, they're going to grow. So I don't understand why. I hear that a lot, like women that say they're too busy to actually, they just ignore their fibroids for years and years and years until it really starts to interfere with their lifestyle, okay? And that's what you don't want to do. Please don't be that person. Because that's very, especially if you know all the side effects and what fibroids can do to the body, and, especially if you know this information. Do not just ignore your fibroids and, expect them to go away on their own. No, you have to do the work, okay? So they can cause issues in the body. I'm talking about from heavy menstrual bleeding to painful cramps to miscarriages to pregnancy complications, okay? I know a lot of women who are pregnant with fibroids, and it is not fun. It is not fun, okay? So fibroids can really wreak havoc in the body. They can Roxanne, a lot of women are just like, they're too busy. They don't want to do anything about their fibroids. It's crazy to me. I don't understand it. And it hurts me even more because a lot of those women are Black women. So, but that's a whole nother topic. So when we're talking about fibroids, they can really wreak havoc in the body, okay? They can grow extremely big in size. They can grow to the size of a watermelon, a football, okay? And that's a lot more common than you think. Fibroids can grow. There actually was somebody that had their fibroids grow from the size of an orange to the size of a watermelon within 2 years, okay? And that's not as uncommon as you think. Fibroids do grow, okay? So let's talk about some of the symptoms of fibroids in case you're watching this and you may not even know that you have fibroids, but maybe you're experiencing some symptoms. So let's talk about some of the symptoms. Constipation is definitely one. And you may not have all these symptoms. You may have just one and have fibroids. That's just fibroids. It could be a range of symptoms. Bloating is definitely a very common symptom. Anemia is very common because, of course, due to the heavy bleeding, a lot of women with fibroids tend to be anemic. You may have pain in your pelvic area, especially during your cycle, your lower back even as well for some women. You have really painful cramps, really bad PMS, okay? You have prolonged menstrual cycles. Your menstrual cycles can, last longer than 3 to 4 days, okay? Also, they may be irregular. You may bleed in between your cycles. You may spot in between cycles as well for days at a time. You may pass clots during your cycles as well, your menstrual cycles as well. That's another symptom, okay? You also may be experiencing infertility because that's one of the symptoms that can be one of the symptoms of fibroids. Due to the location of the fibroid, depending on the location, you may experience infertility. You may also experience, pain during intercourse as well. Also, one thing that's really common is frequent urination because the fibroid sometimes will press on the bladder. So that's another thing as well. And much, much, much more. There's so many symptoms when it comes to fibroids. And like I said, it ranges from woman to woman. Okay, you may be asymptomatic and still have fibroids. That happens sometimes as well. Meaning you have no symptoms, right? And the only way that you can really confirm is like through a sonogram or MRI that you have fibroids. Okay, so most women they don't know until maybe they're pregnant that they have fibroids. And you don't want to find out then. Definitely don't. So, and a lot of women may start off as having no symptoms, right? And then all of a sudden they start having symptoms due to the fibroids growing. So that's why I tell women, please don't ignore your fibroids. Please don't ignore your fibroids, because they're just going to continue to get worse. And I even sent out an email to my email list. By the way, if you're not on my email list, get on my email list. Okay, I sent an email to my email list of a list of all of the long-term effects of fibroids, from kidney failure to pregnancy complications to even, cancers, uterine cancer, because the same things that cause fibroids cause uterine cancer and breast cancer, okay, because it's estrogen dependent, okay? So now let's talk about the top fibroid triggers. I'm just going to name a few because this video, I don't want this video to be too long, all right? So number one, the top ones is dairy, okay? Dairy will feed your fibroid. I'm telling you, dairy, anything with dairy in it, okay? So dairy is just full of artificial hormones, including synthetic estrogen. These things are given, to the baby cows or the calves in order for them to grow and produce unnatural amounts of milk. Okay, so, in that milk, there's added estrogen, right? And when you're dealing with fibroids, you are already estrogen dependent. You already have higher than normal estrogen levels, okay? Which, like I said, in time, that's why the fibroids developed. So if you already have high estrogen, just imagine putting the synthetic estrogen of another animal inside your own body and what that does to your hormones. That creates, and what type of environment do you think that's going to create, okay? The antibiotics in dairy that they give, the cows, has a very destructive effect on your gut health. And when we're talking about your gut health, if there's issues with your gut, there's going to be issues with how you metabolize estrogen, okay? And which is therefore, like I said, going to create, like I said, more excess hormones in your body, more waste in your body. This is how this is how fibroids develop. This is also how fibroids get worse. And if you're watching this and you don't have fibroids, this is a way you want to prevent fibroids, by getting rid of the dairy. That's, you also want to watch this video to know what to get rid of in order to prevent fibroids, because this can also not only cause fibroids to grow, this can also create fibroids to develop in the body. Okay, so make sure y'all share this live, okay, because this may save a woman from getting fibroids. Okay, dairy is highly inflammatory. It's a highly inflammatory substance. I don't want to call it a food because it's not food. Okay, it's a highly inflammatory substance. Okay, and it does directly lead to the development and also the growth of fibroid tumors. Okay, so you want to get rid of the dairy. I know that it's hard. Okay, as somebody that went through myself years ago, I know that getting rid of dairy is hard, but it's worth it. I'm telling you, you're destroying your body by eating things that have dairy in them. I'm telling you that right now. Okay. Also, dairy is filled with mucus, you guys. So average person already has excess mucus, excess waste, and it's filled with inflammation. So then what happens when you eat something that's highly inflammatory, that's filled with mucus and pus and all sorts of things from another animal? And did you guys know the natural color of dairy, of cow's milk, is not even white? It's actually like off yellow color. They actually bleach it to make it white so they can disguise the blood and the pus and all that crap, so you won't know what you're really drinking. So please get rid of the dairy. Get rid of the dairy. It literally feeds your fibroids. Roxana, you could do your research on this. Do your research on it. I'm telling you. And if you live in another country, people from UK know milk is not supposed to be white, okay? So did you also, most dairy cows most cows in the US are filled with soy, are fed with soy, are fed with soy, okay? Because like I said, they're pumping antibiotics, they're pumping synthetic estrogens and all that stuff in, these cows in order to make them grow and produce all these unnatural amounts of milk. You guys need to do some more research on the dairy and milk industry, okay, and how they treat these animals, okay, and see what they're feeding these animals. Y'all should do, and this is what we're eating. This is what people are eating, okay? Yes, doctor, I want y'all to do research on the dairy and milk industry and see how they treat these animals, what they give these animals in order for them to produce all these unnatural amounts of milk, okay? Okay, so we gotta get rid of the dairy. And when it comes to dairy is in so many things, okay? It's in so many things. Like, so many products, like, because a lot of people are eating straight from the box. They're not eating, like I said, natural foods, okay? They're eating from the box. So I need y'all to look at the ingredients, read ingredients so you can see whether something has dairy in it or not, because dairy is in a lot of stuff that you would not even expect. And it was not until I got rid of dairy a few years ago that I actually saw, like, wow, dairy is literally in most things that are boxed. It's in the majority of things. So you may say, oh, well, I don't drink milk like that. I don't really, eat cheese like that, but you still may be eating a lot of dairy if you're not checking your ingredients. So just be mindful of that. You gotta know what you're eating. You gotta know what you're putting into your body, okay? Now let's talk about the alcohol. This is another one that a lot of people have issues with. And, because, people love their alcohol. People love their I don't get it. But this also includes the wine, ladies, okay? Wine, this does include wine. So when we're talking about alcohol, we're talking about, when we're talking about fibroids in general, right? Fibroids thrive in an estrogenic environment, okay? And alcohol is known to raise estrogen levels in your body, okay? So what do you think that's doing to your fibroids? Alcohol interferes literally with the hormone production in your body. Alcohol is terrible. Like, it's horrible for anybody with fibroids, especially, but for anybody in general, but especially if you have fibroids, because you already have a compromised liver. And I'm going to explain that in a little bit. But studies even show that women that have fibroids, okay, studies show that they reported feeling increased pain after drinking alcohol. So, and that's due to the dehydration, because alcohol is very dehydrating, and also the increased inflammation. And if you have fibroids, that already means that you're dehydrated, you're filled with toxins, and you are mineral deficient. Okay, so why would you then add alcohol to that? I've been doing good though, cutting the dairy. Great job, my favorite ice creams. I eat it every now and then. Okay, great job, yes. And also, I know they have dairy-free ice creams as well. So just to let you know. But yeah, so if you have, for most women that have fibroids, right? For all women that have fibroids or any type of reproductive health issue, if you have fibroids, endometriosis, cysts, polyps, if you're infertile, if you're watching this, right? That already, more than likely, you have a compromised liver. And I'm going to explain why. The reason why is because when your liver is responsible for removing like excess toxins, excess hormones, right? Excess waste. So if you have fibroids, if you have endometriosis, if you have cysts, that means your liver is not removing those things. Like, right, that's why those fibroids were created in the body. That's why your cysts and your endometriomas were created in your body, right? Your liver is not doing its proper job on an efficient level to remove those wastes and toxins, right? Your liver is overloaded and it's compromised, right? So then what do you think happens when you pour alcohol into that? What do you think happens when you pour alcohol into that, okay? Your liver is vital when it comes to digesting food, removing poisons, regulating your hormones, and restoring energy. And when you put things in your body to destroy your liver, right? What do you think is going to happen after that, right? So, if we're dealing with fibroids, we have hormonal imbalances already, right? We already have excess estrogen. So imagine what you're doing to your liver when you put things like sugar and alcohol and things that are hard on the liver. You want to stay away from things that are going to overload your liver when you're talking about fibroids, okay? So leave the alcohol alone. Leave it alone. Like, it's very destructive to the liver, to the body. Very dehydrating. And you are already dehydrated severely if you have fibroids. So you're just making it worse. And you're just feeding, like I said, alcohol thrives in an estrogenic environment, okay? Another thing I want to talk about that's hard for people to let go of is coffee. Okay, this one's the big one. Caffeine in general, let me just say caffeine, but for most people it's the coffee, right? Chocolate, whatever, that is included as well. Caffeine in general, it's very inflammatory, very, very inflammatory. And when we're dealing with anything that's inflammatory, of course, it's going to feed the fibroids. So for some reason, caffeine is most people's drug of choice. And that is very horrible because it's very destructive when it comes to your hormonal system. When it comes to your hormones, it dehydrates your tissues. It dehydrates your cells, okay? And it also makes them more weak and more susceptible to reproductive health issues, to sicknesses. Coffee is it's a dehydrator. It's very dehydrating. And you're already dealing, and like I said before, you're already dealing with dehydration when you have fibroids. Okay, so it's very, and you guys can look this up. Coffee is very destructive to your uterus, to your heart, to your kidneys, to your liver. Okay, it has when you drink coffee, when you drink caffeine, your body's working, your organs are working like overtime for no reason at all. It literally puts your body in fight or flight mode. Okay, so it's really destructive, and also it's really destructive to the nervous system as well. Okay. So your organs are already vulnerable. When we're dealing with fibroids, when we're dealing with cysts, when we're dealing with endometriosis, you are already, or any type of sickness, your organs are already vulnerable. So then, add in coffee and overworking your organs for no reason at all. It's really, like I said, it's very destructive, okay? And the same goes that for men who have prostate issues, because that's also an estrogen issue, okay? So which is also very common among men. So it's not just women that are experiencing, these hormonal imbalances. Men are too, okay? A lot of men are experiencing, prostate issues, ED at a very young age. That's a whole nother topic. So your coffee, caffeine is feeding the fibroids, okay? And it's just not worth it. It's not worth it, all right? So get rid of the caffeine, get rid of the coffee. That includes decaf as well. Okay, replace that with herbal teas. Okay, that's going to be more beneficial for your body than caffeine. Okay, and if you're eating a nutrient-rich diet, why do you need caffeine? Why do you need that coffee in the morning? That means that what you're eating a trash diet if you don't have energy in the morning. Okay, more than likely. So let's also move on to hair relaxers. I don't want to spend too much time on this because a lot of people should know by now that hair relaxers are very destructive. They have actually an entire group of chemicals that are known to be hormone disruptors, and they really wreak havoc on your health. There's been multiple studies, there's been multiple lawsuits of people suing these hair relaxer companies for getting fibroids, for having to have a hysterectomy, for just for being infertile, for a multitude of things. So you guys do some research on that, okay? Hair relaxers, please do not even, engage in those things, right? They're extremely harmful for your hormones, okay? And they're part of the many reasons why a lot of Black women are suffering from fibroids today, okay? I also want to talk about birth control. I was talking to somebody today and they were saying that they had fibroids, they had polyps, and that the doctor put them on birth control to regulate their cycles. Let me just say this. Birth control is not going to regulate anything. As a matter of fact, all it's going to do is suppress your own natural hormones and, of course, make you not ovulate, which is not healthy, by the way. And you're not going to feel the effects of the birth control right then and there. But it is, like I said, it's adding, it's going to destroy your health because you're pumping your body literally with hormonal, with synthetic estrogen, with synthetic hormones. So if you're pumping your body every day with synthetic hormones and you're suppressing your own natural hormones, you're literally creating a hormonal disaster within your body. This is why a lot of women have health issues, right? When I ask questions things like, for example, even diabetes, blood clots, insulin resistance, women don't attribute that to them taking birth control. A lot of women have health issues that they don't think is related to the birth control that they took for years and years and years, okay? This stuff is poisonous. It's a group 1 carcinogenic. I don't understand why women are still taking it in 2023. And to regulate their cycles, no. It's actually doing more harm than good. Birth control is the reason why a lot of women have fibroids. A lot of women are infertile. I'm going to be honest with you. Birth control is horrible. It's horrible. My dad has been fighting prostate cancer for 11 years now. He's 67. Oh my God, I'm so sorry, Roxana. Wow, I'm so sorry to hear that. Birth control is horrible, right? And it does lead to breast cancer. There have been studies that's shown that birth control does lead to breast cancer later on. So please get off the birth control, please. And that includes the IUD, the copper, whatever. People always ask me, well, what about this one? All of them are trash, okay? So we gotta stop doing things that's gonna disrupt our body's natural hormones, that's gonna suppress, our natural hormones, and think that we're not gonna feel the consequences of that, right? We gotta stop doing that, okay? The birth control raises your estrogen levels because, again, it's feeding your body with synthetic hormones, and when that's mixed up with your own hormones, that's a disaster right there, okay? So get off the birth control. It's horrible. And also too, we're talking about, it does, like I said, it overloads the liver because you're flooding your body with synthetic hormones. So that's going to overwhelm your liver, right? And we already have a problem with the liver working efficiently when we have fibroids. So see how it's just horrible. I hate the fact that doctors are still prescribing birth control for fibroids and endometriosis and all these other things. It really like pisses me off because they're literally making things a lot worse in the future. Instead of literally giving the patient a wellness plan, you know, in order for them to naturally regulate their hormones, right? That's what I do for my clients. Why don't they do that for their patients? It makes no sense, right? So, you're like I said, you're making things worse. The birth control, like that effect on your organs, on your hormones is very destructive. Okay, I'm gonna keep saying that because there's still women that's taking birth. I don't understand why. I don't get it. And most women, it's not even for contraceptive reasons. It's to regulate their reproductive health issues, which makes no sense. So myself being on birth control on and off for over 25 years, oh my God, must be a huge contributing factor. Absolutely. Pills when I was younger, IUD, my God, I'm off now. Thank you. Woo, I'm so happy that you're off now. Yes, for sure. It's very destructive in the body. A lot of women, you know, a lot of young girls are on birth control. They don't know, like, you know, their doctor just put them on it. So a lot of people were on birth control when they were like 14, 15, and it's sad. And those same women are dealing with fibroids, are dealing with endometriosis, are dealing with, you know, insulin resistance, are dealing with all sorts of reproductive health issues right now as we speak. And so please, and if you're watching this and you have a daughter that's a teenager and she's having, you know, really bad periods, please don't put her on birth control. Instead, let her, like, come to me, like, let me, so I can help her regulate her cycles the natural way. Please, but don't put your daughters on birth control, please, please. Oh my gosh, please. Okay, so let me go on to number 5. Okay, this one a lot of people may not like, but it's the truth. I have to be honest with you. So having an unhealthy amount of body fat as well is very, like I said, is one of the top contributors of fibroids, one of the top triggers of fibroids, because you have to understand that when we're dealing with excess weight, right? We're dealing with excess body fat. That those fat cells, those excess those excess fat cells will create more estrogen in your body. Fat cells secrete estrogen, right? So when you have excess fat cells, that's going to secrete more estrogen, okay? And when you're dealing with fibroids, you already have a estrogen imbalance. So now you're adding more estrogen because because of the weight, the excess weight, right? So this is going to be very destructive, you know? Your goal needs to be to regulate those estrogen levels. But when you, like I said, when you're overweight, that, like I said, and your hormonal levels will by default be higher. Your estrogen by default is going to be higher, right? So that's why you see a lot of overweight people do have fibroids. I'm not saying everybody that's overweight has fibroids or reproductive health issues, but it's definitely a correlation there, okay? So you gotta lose the weight. I was overweight too. That's why I got fibroids twice, okay? I had to lose the weight. I lost almost 60 pounds, okay? Very important because fat tissues, they store excess estrogen, right? They secrete excess estrogen, okay? Being overweight means that you're gonna naturally just have, you know, higher hormone levels. So you gotta get rid of the weight. But the best thing is that as you are losing the weight, if you're doing it the healthy way, right? If you're losing the weight the healthy way, you're also healing your body, you're healing your womb, right? You're helping your body shrink those fibroids. You're helping your body regulate your hormones, right? So that's the beauty of it, right? As you're on the journey to lose the weight, you can do both at the same time, okay? Heal yourself and also lose the weight at the same time. That's what a lot of my clients are doing right now, right? And they're doing absolutely amazing. As they're healing their womb, as they're shrinking their fibroids, they're also losing tons of weight. I had one client that lost 53 pounds working with me, right? And she got rid of all her cysts. She got rid of her breast and also her ovaries. And she had 5 fibroids. One completely is gone completely. She only has 4 left, and those all have shrunk. Okay, and she's still working with me, so we're gonna get rid of all 4 of those fibroids that are left. Okay, so, and she feels absolutely amazing. So as you are healing your womb and getting rid of your fibroids, okay, it's as you're also losing weight, but also for ladies that are like of normal weight who don't want to lose weight, there's also things that you can do as well to maintain your weight and still, like I said, you know, go on your healing journey. I have ladies who are actually trying to gain weight. Some are just trying to stay their same weight in my program, in my Detoxify Your Womb program, okay? So I say all that to say, if you're watching this and you are suffering from fibroids and you are confident in yourself and in your body that your body can heal your fibroids, right? Your body can shrink your fibroids. You know that is true. You've seen it. People have done it. You know, I've done it. Many of my clients have done it. If you're confident and you believe in holistic and natural healing, okay, I do have an amazing program that has been very successful in helping women shrink their fibroids and get rid of their fibroids as well, okay? And my program utilizes my womb detoxification plan. I've helped many women get pregnant that were infertile in the past. I've helped many women get rid of fibroids, cysts, you know, all sorts of things, you know, excess weight, excess belly fat, and the list goes on. Help many women also get rid of other health issues as well, okay? So if you are interested, okay, the Detoxify Your Womb program is a 3-month fully transformative program. Truly, like I'm talking about if you're ready to transform your life, okay? If you're ready to get rid of those bad habits, okay? And get rid of those bad lifestyle habits and really step into a new person, okay? And really do the work to let go of the old you the old you that caused the fibroids to develop, to let go of that person and really step into the new habits, new lifestyle habits, new diet habits, okay? A new you, okay? If you're ready to do that, okay? And I want you to join the Detoxify Your Womb program. It's 3 months. You're working with me, okay? I'm going to help you. I'm going to guide you, support you, okay? In healing your womb and restoring balance within your body, getting rid of your fibroids or any type of reproductive health issues, and living the best healthy life possible with balanced hormones, okay? Because all these womb health issues that we're currently dealing with is adding on to, you know, depression and anxiety and all that stuff that we're currently dealing with is lowering our quality of life, okay? Fibroids will lower your quality of life. Okay, so with these other womb health issues, they're going to lower your quality of life. If they're not now, then if you don't do anything about it, they eventually will. So really, really important that you actually do something about your fibroids. Even if you don't work with me, work with somebody, okay, to get rid of your fibroids, okay? And don't just go through the surgery route, because we know that the surgery, I mean, they're going to come right back, right? We know that by now. We shouldn't know that by now. You got to stop doing the things that trigger those fibroids, right? So, all right, if you're ready to work with me, I have in my caption the link of the Detoxify Your Womb program. You can get all the information there. If you need more information, for example, if you want to talk to me and tell me more about what you're going through and see what service I have that's right for you, I do still have my complimentary Zoom calls, 30-minute Zoom calls. You can also click the link in my caption to schedule one. All right, I opened up for April, so I should have more open spots next month, all right? So go ahead and book one because they fill up fast, all right? But that's pretty much it. These are the I want to talk about some of the few fibroid triggers. These are the ones that I see a lot of people engaging in, and a lot of people don't know that things like dairy and alcohol does feed their fibroids. It makes then disrupts their hormonal balance, okay? People don't know that. So I'm putting the information out there. Share this live with somebody, okay, with another Black woman who is suffering from fibroids, or any woman who is suffering from fibroids. Share it. Let more women see it. Really, really important. All right, so that's pretty much it. If you guys have any questions, leave them in the comment section. I will come back to answer them. All right, love you guys. If you're watching the replay, make sure you guys are liking the video as well. All right, have a good day. Bye.